One of the problems with in vitro fertilization is that we're putting more than one embryo in most cases. And that's characteristically because in the United States, for the most part, in vitro fertilization is not a covered expense. It's out of pocket. And so that for the most part, we are putting 2 embryos in patients, especially if they're 37 or younger, to try to limit the risk of multiple births. If we put 2 embryos in and they're good quality, the odds that you're going to have twins are somewhere between 28 and 40%. Although it sounds great and sexy, I get 2 for the price of 1, there's increased risk of having twins over a singleton, and we really would prefer a singleton. So there has been a move of late to do single embryo transfer. And it usually applies to about 10–15% of patients that are younger, have excellent embryo quality, and can reach the blastocyst stage and have at least 2 or 3 high-quality embryos for transfer. When you do this, the outcome is no different than if we put 2 in, but we have essentially close to 0% twins. One of the problems as women age is we need to put more embryos in to overcome that aneuploidy, because they just don't make that many normal embryos. So you end up putting in 3 and sometimes 4, and in women 40 and older, sometimes 5 embryos. And on occasion, you can get triplets or quads, although I've never had more than quads, and that's not a good thing. We really don't look at a higher order multiple as a good thing. And all of the efforts within the industry have been to limit the number of embryos we transfer based on quality, the woman's age, and previous history. So we want to limit that. The other risk of in vitro fertilization is too much of a good thing. We're stimulating with medications and they get too much. The ovaries get big and cystic and enlarged, and this can result in hospitalization for the couple, for the woman, and can be life-threatening if not recognized and treated. So we try to also make our stimulation protocols meet the individual to reduce the incidence of hyperstimulation.